Today we're going to talk with Carola, who is a neurologist and a geriatrician, about patient journeys and how they develop patient journeys to really tackle all the problems that patients has and to understand how the disease evolves during time. Thank you, Carola, for being here with us today and for answering some questions.
Hi, Eva. Thank you for inviting me.
So today, really, when we start to look at digital tools, where do we begin if we really want to understand a disease from the point of view of a patient? How do we do that?
To fully comprehend the requirement and needs of the patient, it is important to learn more about their diagnostic pathway, about potential obstacles they have to deal with, to learn more about also the likely disabilities they foresee as a result of their disease. And so maybe for me, it is easier in some diseases to understand that due to my experience as a physician in the hospital. However, I think it's important for the whole cross-functional team. And that's why we usually start at Roche with a so-called patient journey. So we try to learn more about the disease and experience the disease from the perspective of the patients. And in preparation for such a so-called patient journey, we hold several interviews with the patients. We hold several discussions with patients and physicians, and depending on the disease, also with other stakeholders. And as a whole cross-functional team, we then develop a patient journey to really understand the requirement and needs of all the different stages of the disease. And subsequently, this patient journey becomes really the basis for all our activity we are planning in a specific disease area.
And thinking about digital tools, do you see opportunities? So looking at the patient journey, do you see any gaps where you can say, well, maybe with a digital tool here, we could really make an improvement for the patients?
In the early stages, the challenge is really to have an early diagnosis, and there is a high potential for digital tools, at least to support existing methods in these days. And beside the early diagnosis, I think also the awareness is a potential field where digital tools can support. Also in the later stages, so to support professional and laymen in how to deal with challenging situation within the Alzheimer's disease, for example, like behavioral disorders or the tendency to wander. And there I could imagine, for example, a virtual reality to train nurses and relatives. And so I think we have two different opportunities. So in the diagnostic, but as I mentioned, also in the treatment.
When talking about digital tools, we discussed that it's possible, maybe also right now already, to have in the diagnosis phases support from digital tools to really to understand the disease and how it's actually affecting the person. Do you imagine that in the future we will also be able to see digital tools as therapy options for these patients?
Mm-hmm. Yes, I could imagine digital tools also as a therapy to support, or as I mentioned before, to really maintain the self-determination and the independence. So to support patients, to provide faults, or to support patients and to also train some parts of the memory. And what we see a lot during the severe stages of a dementia are behavioral disorders and for example, also the tendency to wander. And so I think it's there could be a huge opportunity to support also the professionals and the relatives during the therapy to deal with the situation and become more comfortable and familiar with such situations.
Thank you very much, Carola, for all these insights and for explaining us how you approach a disease like the Alzheimer's disease that is really complex with the help of patient journeys. Thank you.
Thank you.
Hi, I'm Gabriel. I'm co-founder and COO of RoX Health. We believe that everyone has the right to experience good healthcare. If you have a great idea or your startup wants to enter the German market, leave us a message.